So good morning. I am Dr. Shilpa Karkera, Assistant Professor from Department of Anatomy and Neuroscience, Trinity School of Medicine. My topic of presentation is Anencephaly, Incidence, its risk factors and biochemical analysis of mother. So first of all, you have to know about how the neural tube is developed. The neural tube is developed at fourth week, that is at the end of the fourth week, the neural tube will become from the surface ectoderm, it will be getting detached and it will become a separate tube that is called as neural tube. Now, sometime due to faulty induction, the cranial end or else there might be a caudal end or entire part of the neural tube might be defective in closure. Now, this abnormal closure is called as neural tube defects. Among these neural tube defects, the one important defect is anencephaly. Now this anencephaly, the cranial end of the neural tube is exposed to the exterior. Along with that, the cranial vault also is absent. Now incidence of anencephaly is about 1 in 1,000 to 1 in 20,000 birth. It depends upon our different countries as well as different area wherever it's present. Now in a present study, we have collected all the specimens which was identified as neural tube defects, that is specifically we have collected anencephaly, that is from government hospital which is attached to Bangalore Medical College, that is from the Vani Vilas and Victoria Hospital from August 2014 up to July 2017. We have included the 60 fetuses and the age group of the fetuses were from 20 to 30 weeks. And for this study, the ethical committee clearance were taken, as well as there were an informed consent from the parents of the fetuses were collected. And entire procedure of the study were informed to the patient, as well as their maternal history, the dietary history, and environmental, family, and clinical history were taken. Along with that, we took a 2 ml of EDTA as well as 2 ml of whole blood before delivery to find out the alpha-fetoprotein levels as well as folic acid, acetylcholinesterase, and blood glucose level. Now, once the blood was withdrawn, we have sent the blood for biochemical analysis, and the fetuses which we collected from OBG department were embalmed with 10% of formalin. And then this embalmed specimen is then kept for fixation for 24 hours, and later on these specimens, that is these fetuses, were kept in a supine position and they were dissected using the scalpel blade. Now, why we have dissected is we want to check whether only the anencephaly is present in the fetus or whether there is any other associated anomalies along with the anencephaly was present. So for that we dissected the fetuses. Now whatever the data we got it after dissection as well as the biochemical analysis, then we have put it in a software called as SPSS software. And then we have made a statistical analysis to find out the statistical significance. Now, once the results, all these specimens were then categorized into different subheadings. That is, there are total about around 57,429 deliveries were conducted between 2014 to 2017 from Vani Vilas and Victoria Hospital, and out of these specimens only 60 cases were anencephaly. And age group of the fetuses were plotted in this. So totally around 6 fetuses, and you can see around these all are the ages of the fetus, and this is the number of the cases, that is frequency. Then in the case of males, it is 23 cases, and in the case of female, it is 31. So, as usual in the literature, the female fetuses will have more tendency to have anencephaly than comparative to the male fetus. So, in our study also, we had a females as more. And these are the birth orders. If you see here, these are the birth order, that is first order, second order, third, and the fourth order. And these are the frequencies, and these are the percentage. The next, we have also done a study on season of birth, that is spring, autumn, winter, and summer. So in our study in autumn, we had 26.6% of cases, and in winter there are 40% of cases. So as usual, like any other countries who have done the same research, so in our study also in winter we had more cases of anencephaly. The next is about the maternal and paternal history, and we have categorized the maternal and paternal history into a different age groups, that is below 20, between 21 to 35, 36 to 40, and above 40. So these are the cases, these are the persons, and these are the frequencies in the case of males and in the case of female, that is in the case of mother as well as the father, and this is the mean of the age. The next is about occupation, because occupation also plays an important role in getting a neural tube defect. So there are around 46 cases where the mother was a housewife, and in one person she was a garment factory worker and farmer and also a group D worker. And educational qualification of the mother is below high school, above high school, and graduate. So we have made this as. Now, it doesn't mean that the people whoever is less educated, they will get anencephaly. There is no any correlation. But the people whoever is less educated, they will not have a facility, or they may not have a intention to go to or visit a doctor, because the people from the remote areas, they deliver themselves, because as we all know, there are a lot of like they follow the procedures like olden days. So that's why we have made a study on this as well, to know how about the educational qualification of the mother. The next is about teratogen. As I already told you, maybe educational qualification also is a very important, because the patients will not know whether they have to take any medications during pregnancy or no, because sometimes they will have a fever, sometimes they will have a cold, and without doctor's prescription they will tend to take medicines. So that's the reason we also made a study on knowing the medications during the pregnancy, and these are the results which we got. Next is about the febrile illness. So during pregnancy, there is also a chances of having the illness like flu-like illness, there is a malaria, there is SPH, and in our study we found that around 86.6% were normal. So the family history is like, in one case of anencephalic fetal, mother's nephew had Down syndrome, and another around a father had also a hypothyroidism. Then clinical history during the pregnancy, that is abortions, asthma. So we have classified into diabetes, obesity, hypertension, and around in a normal patient, that is 81.6 were normal. So these are the frequencies. And also we have also made a study on folic acid consumption, around 23.3% none. There were no consumption of folic acid, but around 5% there were preconception, first trimester, second, third, first and second, first, second and third. So these are the timing of consumption of folic acid. Now why we have done the study? To know whether the mother has taken folic acid or no, because folic acid is very important component which is required for the development of central nervous system. So it is very important for mother to take folic acid. That is because of if there will be lot of developmental disorders if there is any deficiency of folic acid. So it is very, very important to know about the folic acid consumption. The next is about socio-economic status, that is low around 86.7% and medium is 13.3%. Consanguinity also will play a very important role in developmental anomalies, because in our study we have got around 15% of mother were a consanguineous man, that is where they were a first cousins, and remaining were the normal unrelated. Occurrence of anencephaly, because once if we get anencephaly or any neural tube defect, there is a chances of getting it again. There is a chance. So in our study also, there was 1.6% of the cases O negative mother had 3 continuous anencephalic, and there were 2 continuous anencephalic fetuses. Along with anencephaly, as we already told you, there is a chances of getting associated anomalies. So in our present study, we have got 70% of the cases had a anencephaly. Along with that, there were a lot of other associated anomalies. But now, in all the fetuses, it had a acrania, means cranial vault was absent, whereas in 19% as Spina Bifida, it is one more type of neural tube defect along with this anencephaly, and around 100% there were no any abnormality in reproductive system, but there were so many other abnormalities which we have seen. So if you see, we have described the system on the right, and this is a male, this is a female fetuses, and total, and these are the percentage. So we are going to see about associated anomalies. So skull and face defect, vertebral defect, that is spina bifida, the limb defect, there is cardiovascular, there is respiratory system defect, there is GIT, there is urinary system defect, there were a reproductive system, there were hernia, there were umbilical, abdominal wall defects, as well as there were also other anomalies along with the anencephaly. So if you see here, skull and face defects. So in one person, in one case, there were nasal placodes were absent, and also cleft lip and cleft palate was seen. In the case of female fetuses, around 3, there were a cleft lip and cleft palate seen, and also other defects like ear, nose, and macrosomia, malar prominences, and jaw deformities were not present. Vertebral defect, as I already told you, spina bifida. So around 19 cases had a spina bifida, and it was very common. So if you see cervical, thoracolumbar, lumbosacral, and sacral segments. So these are the male and female fetuses, and these are the percentage. The next is about the limb. So amelia and dislocation in one, and congenital dislocation in one more fetus. So if you see here, there was a umbilical hernia, there were a amelia, absence of the limb, and also there were a cleft lip which was seen. And there were one case where we found there was a cardiovascular disorder, that is, there were a 2 outlet which was seen, as well as there was only a single ventricle which was seen. There were no any 2 ventricle. There were only 1 ventricle. Within that ventricle, there were 2 outlet which is seen. Maybe it is for one for the aorta, another one was for the pulmonary trunk. Respiratory disorder, that is about one case had a left lung which has a 2 fissure, and it had a 3 lobes. So if you see here, you can see, I don't have the image of this, but I do have the image of the right lung which has a 1 fissure and it has a 2 lobes. So these are the anomalies which is seen on the respiratory system. And also there is a malrotation of the gut seen, and also in one person there was a absence of pancreas. So if you see here, there were an absence of pancreas in this case. The next is urinary system. In one case, there were a horseshoe-shaped kidney and there were a multiple ureter. So if you see here, this was a horseshoe-shaped kidney which is seen, and there were a multiple ureter, what you see on the left side. The right, 2 ureters were seen on the left side. The reproductive, as I already told you, 100%, there were no any reproductive anomalies, but other anomalies like hernia, which we already seen, that is male umbilical hernia. In this case, we have seen there was a hernia, umbilical hernia which is seen, as well as diaphragmatic hernia was not present in any of the cases in our study. Now, other anomalies are like amniotic band syndrome. Now, what is this amniotic band syndrome? There is a band which is arising from the nasal placode. If you see this image, there was a band which is present. So this is amniotic band syndrome. There was a encephalocele present where cerebellum and entire small aspect, and along with that there is a spina bifida as well. That is. So these are the cases, and you can see omphalocele, there was umbilical hernia. So these all are the hernias which we have seen along with the anencephaly. Biochemical analysis of the mother. So around 100% of mother, the alpha fetoprotein levels were high. Why? Because any neural tube defect, the alpha fetoprotein level will be increased. There will be a surge of this protein. Now this is a confirmatory test to find out the anencephaly as well as the neural tube defects. Now these are the normal values of folic acid. This is acetylcholinesterase, and blood. We have done a random blood sugar level, and it was alpha fetoprotein level, acetylcholinesterase, folic acid, and random blood sugar. And H means it is high, L means it is low, and N means it is normal. So this is how it is plotted. So as I already told you, alpha fetoprotein level is high in 100% of cases. Acetylcholinesterase in 85% of cases it was normal, and 13.3% it was low, and 1.7 cases it was high. Folic acid level in 68.3% of cases it were normal, 28.3 cases it were low, and 3.4 cases it were high. Random blood sugar level was high in 15% of cases, and they were diabetic, and 3.4% very low, and 81.6% it was normal. And these are the mean differences and standard deviation of the maternal biochemical analysis. Now in a study, we have found that incidence of anencephaly in Victoria and Hornevanivilas Hospital is 1.04 in 1000 birth, and majority were female, which I've already described. And there were a lot of studies which was done, like a hospital-based studies, which included 5,761 cases, out of which 50% had, that is 50 cases had congenital anomalies. The gestational age were about 19 to 44 weeks, and out of that 50 had a CNS anomaly. So in that, the 14 were anencephaly, and 2% has consanguineous marriage, and 5 patients has a previous history of abortions. We have compared our study with Tan et al., with Ware et al., and Nilsson, Panduranga, Singh et al., and these are the total incidences in their study, and these are the associated anomalies which is present in that study, and we have compared that anomalies with our findings. Now, why we have done this study? To know the better knowledge of unexpected fetal loss and promise for better prenatal counseling and prevention of recurrences. Understanding and identifying the risk factor associated with anencephaly in our population, as well as it will allow the approaches to avoid them and thereby lower the incidence of anencephaly in our population. Regular follow-up of patients with anencephalic fetuses will help in improving our knowledge of functional outcomes and future complications. This also will give an opportunity to give timely guidance to these patients, which will help in improving their quality of life. Now, the chances of occurrence of anencephaly is high. Hence, 4 mg of folic acid should be taken before 6 months of conceiving or entire pregnancy. And also, nowadays, there is a chances of transplantation of organs. Hence, as there is a requirement of organs, so majority of the organs which in our study we found it is anatomically as well as histologically it was normal. Hence, anencephalic fetuses organs can be transplanted. So these are my references. Thank you so much for giving me this opportunity.